Welcome to today's press briefing. We have with us from the CHP, Head of Communicable Disease Branch, Dr. Chang Shok Kwan, and from the Hospital Authority, Chief Manager, Dr. Lau Ka Hin. Dr. Lau will report about the situation in HA, and Dr. Chuang will speak about updates on cases. Dr. Lau, I'll give you an update of the situation in the Hospital Authority. We have 1,485 patients staying in hospitals. 162 of them are new cases. Those who are in isolation facilities, 408 of them are staying in isolation ward. 82 are in second-tier isolation wards. 434 of them are in the North Atlanta, Hong Kong Infection Control Center. There are 133 new cases. Yesterday, we reported another 4 cases in critical condition and 5 serious cases. Of those staying in hospitals, there are 25 critical cases and 20 serious cases. 7 critical cases are staying in ICU. We have also reported 5 new death cases, 2 males and 3 females, aged between 65 to 94. Of these death cases, 1 came from care home. Of the 5 people, only 1 completed the course of vaccination of COVID-19. Of the 5 cases, I'd like to give you more details on 2 cases. 1 is a 94-year-old male. On the 19th of July, he had an RAT positive result. He suffered from fever, sore throat, and mild breathing problem. He went to the A&E department. This male person suffered from a number of chronic illnesses, pulmonary chronic illnesses relying on a low dosage of oxygen, hypertension, prostate gland enlargement, previously suffered from tuberculosis. We asked him questions and we learned that his son was tested positive by RAT, but the case was not reported. So we would like to say to you, now if there is an RAT or PCR positive result, please report the case to the Department of Health. Once it's reported, we will make assessment as to whether it's suitable for you to be isolated at home. If there are elderly people, people with chronic illnesses, it will be better for you to be isolated somewhere else in order to prevent infection by vulnerable household members. Another case is a 94-year-old female living with family members. She suffered from chronic illnesses including hypertension, arrhythmia, heart failure, as well as high thyroid reaction. She went to a private doctor because she felt unwell, but there was no record as to whether she did any RAT or she's been prescribed with any antiviral medication. On the 26th of July, she was tested positive by PCR. On the 29th of July, she did an RAT. It was negative. However, she had phlegm and she was coughing, but she did not see a doctor anymore. On the 4th of August, the patient felt there was discomfort on her chest, and she continues to suffer from congested cough. She was admitted, and there was a PCR test done with a CT value of 32. We reckon that the viral load continued to drop, but her bodily condition continued to react to the virus. It affected her lungs, and she passed away yesterday. If you feel unwell, especially symptoms of upper respiratory disease, please do an RAT or a PCR to make sure to find out whether you have contracted COVID. And if that is the case, and if you are a chronically ill person or elderly, please see a doctor, use our designated clinic, or use the remote consultation service. This would enable you to be prescribed with antiviral medication, and this in turn will reduce the risk of a serious condition. For the other 3 cases, they suffer from chronic illnesses, including coronary diseases, heart failure, dementia, hypertension, diabetes, etc. 138 patients recovered in the past day. 114 of them have been discharged. 1 patient was found to be positive with COVID upon admission screening. 1 patient in the same ward is classified as close contact. In terms of staff members, we have altogether 26,526 that have at one point been positive. 25,933 of them have resumed their duties. That's all for my report for today. Good afternoon. We have local positive cases 4,050 and 35 cases, including 1,410 PCR positive cases and 2,625 verified RAT cases. There are 239 imported cases, including PCR positive cases 214, and for the other RAT positive cases 25. Dr. Lau mentioned about 5 death cases. In the 5th wave, we have altogether 9,327 death cases. In terms of imported cases, of the 239 cases, 109 of them were picked up at the airport. 100 were picked up at quarantine hotels. 30 of these cases have left the quarantine hotel. They came from 54 countries. 6 of them have imported 10 or more cases. They are India, 35, the Philippines, 24, UK, 22, US, 17, Singapore, 14, and Thailand, 13. For the other 48 places, they have imported less than 10 cases. In terms of care homes, there are 3 homes, including 1 elderly home and 2 care homes for people with disabilities. They have positive cases. Some people have to be quarantined. One is 嗇色苑主辦可場 elderly home in Tuen Mun. 1 resident confirmed, 3 residents who have to be quarantined. 深光護理安老院 is a home for people with disabilities. In the Southern District, 1 resident positive, 10 residents have to be quarantined. 海悅弱智人士之家有限公司 in Yuen Long, 2 residents were tested positive today and yesterday. About 35 residents will have to be quarantined. Today is Sunday. There's no school. 1 kindergarten with 1 case, with 1 class reported 3 cases. 保良局方黃煥啟幼稚園 in Howtak Estate in Cheung Kwan O is K2C upper session. 23 students, 2 pupils plus 1 teacher were positive. So that class have to be suspended for 1 week. For sublineage, just like yesterday, suspected BA4 or 5, there is a slight increase. As at yesterday, it's about 10.4% that are BA4. Suspected BA.2, 12.1 is 7.4%. In the past 7 days, on average, BA4 is about 7.3%. BA4 or 5, 7.3%. BA.2, 12.1, about 7%. That's the preliminary figure. That's all for my report.
The floor is now open to questions. Before putting your questions, please identify your media outlet on the right, the front row, at the far end. I'm from TVB. The local BA.5 cases are making an ever higher proportion of the local cases. Where do you think such cases are going? Will you be considering lowering the age threshold for the 4th dose of the vaccine? Now, for the malaria cases, 200 people from the same company are expected to come to Hong Kong. Some doctors argue that we should provide prophylaxis for these people. Will the authorities consider doing so? And I want an update from the malaria cases. Now, we are monitoring cases involving BA.4, BA.5 subvariant. Now, such cases are on the rise. The latest figures are 10% or so of the total case count. In line with the overseas developments, and based on the stats from the World Health Organization, BA.5 or BA.4 subvariants are overtaking other subvariants in terms of the percentage they make up in the total case count. And based on the latest figures from the WHO, as at August the 3rd, for BA.5 cases, the proportion has risen to 69.6% globally. As for BA.4, the number has risen to 11.8% at a lower level. As for the other subvariants, BA.2, 12.1, it has dropped to 1 point something from 4%. For BA.2, the percentage has dropped to 2 to 1.5%. But for now, luckily, we don't see that the BA.4 and 0.5, aside from having a higher transmissibility, we don't see such variants leading to more severe illnesses. And based on the WHO's information, the vaccines currently available are still effective in protecting against severe illness and deaths. Recently, the Joint Scientific Committee has recommended for those aged over 50, they can get a 4th dose. For arrivals from Guinea, for fellow travelers of known malaria patients, we will have special arrangements at the airport. We will check with them to see if they have malaria symptoms. The HA will also have colleagues there keeping an eye on the situation. We will take blood specimens so that hopefully we can spot the infected persons early on. Anything to add from you, Dr. Lau? As at noon today, we had 58 malaria patients staying at public hospitals, including 56 males and 2 females. Among them, 1 is in a critical condition, 2 in a serious condition. As for the rest, 55 of them, they are in a stable condition. 2 patients, including 1 critical and 1 serious condition, are under intensive care. Our team will closely monitor the patient's health condition and provide appropriate treatment. As for the hospital authority, we will continue to work with the Department of Health in terms of sending medical teams to the airport to help out in terms of finding out from the arrivals from Guinea to see whether they have symptoms and whether they need to be hospitalized early. The Department of Health will continue to do blood tests. If the results show that the arrivals require hospitalization, the HA will do our part to facilitate their hospitalization. Next question on the right at the back, the lady over there. I'm from Now TV. Do we have any additional malaria cases today for arrivals from Africa? Which quarantine hotel are they staying at? Do we need additional quarantine hotels for such arrivals? Now, other than speeding up the turnover at Tier 1 isolation wards at public hospitals, can we have a standalone facility for malaria patients? Is that feasible? We've got news that at Jockey Club, there's a cluster. 60 people were at a gathering. At least 13 have been infected. Many betting stations have to be closed. Is this true? If this is the case, how many have caught the virus and what's the situation like? This morning, we put out the release as at noon yesterday. as at 2 p.m. yesterday, there were 75 cases, and after that point, 3 suspected cases were found, but they are still pending confirmation when they may have symptoms and have been hospitalized. As for the specific quarantine hotel for arrivals from Africa, now they stay at quarantine hotels. For their fellow travelers, they come back in batches to facilitate management. We arrange for them to stay at one hotel called Cosmo Hotel. Now, there are limited hotel spots, so in the days to come, there may be a need for them to go to a different hotel. As for COVID clusters, now we do not disclose individual clusters. For the time being, for malaria patients and during their hospitalization, they are under isolation. Well, this is not about a concern about human-to-human transmission because the transmission happens through anopheline mosquitoes. If mosquito control is in place, the transmission risk is low. Based on information from the FEHD, there's, I don't know, or very few anopheline mosquitoes in urban areas. The reason we are quarantining or isolating them is that they were under quarantine when they arrived. They have to go through hotel quarantine when they are under surveillance to see if they have COVID. Upon hospitalization, they still have to be put under isolation. There is a risk that they may have caught COVID. Now, some people do indeed have both COVID and malaria at the same time. But there are just 58 of them at hospitals. We will keep an eye on the situation if necessary. If there's a greater need for isolation facilities for malaria patients, then we may have to activate Tier 2 isolation wards and hospital beds. And for COVID patients in a stable condition, they may be transferred to Tier 2 isolation wards to continue their treatment. Next question on the left at the back, the lady over there. I'm from Cable TV. For malaria, you mentioned there are 58 patients currently hospitalized. The press release says that 10 of them are from other countries in Africa. Now, what do you mean by other regions in Africa? Some patients have both COVID and malaria at the same time. How many of them are in such a condition and how are they doing? Now, for BA.5 cases, for now, things aren't bad yet in Hong Kong, but is there a chance that the BA.5 will become prevalent, the dominant strain in Hong Kong, and how big is the chance? For imported cases, apart from Guinea, which make up a large part of such cases, there are also other cases: Ghana, Ethiopia, Nigeria, Uganda, Democratic Republic of Congo, Central African Republic, etc. In the past, we saw imported cases from various parts. That is, these malaria patients came from various parts. Based on experience overseas and the WHO's information, BA.5 as a subvariant has an advantage in its growth. The BA.5 may easily overtake other subvariants. There's a chance that BA.5 may become the dominant strain. We cannot rule out this possibility. Now, I don't have a specific figure in terms of how many people have caught both COVID and malaria at the same time. Upon hospitalization, they undergo testing, and they may be found to have COVID at that point. It's also possible that this person had COVID in the past, that is, positive cases, or in a case of a recent infection. So we are treating both conditions at the same time for both malaria and COVID. For malaria, We look at the amount of plasmodia, and then we prescribe the appropriate medicine. And for COVID, those who test COVID positive, we look at the CT value, the symptoms. If needed, we prescribe the suitable medicine.
Next question. The lady at the front.
THK, do you think the BA.5 subvariant will become a dominant strain in Hong Kong? And how worried are you about it? And will infection surge if BA.5 do become a dominant strain in Hong Kong? And second question, should Hong Kong ban people from flying in from Africa? And can public hospitals cope if there are 100 or 200 more malaria cases? Thank you.
I'll answer the first question first. Taking reference from WHO and Singapore and other places, we understand that there's a growth advantage of BA.5 over other subvariants. So there's we can't exclude the possibility that BA.5 will further increase the proportion and it will become the circulating strain in Hong Kong. We understand that BA.5 has a higher transmissibility, but fortunately, we do not have evidence of that this strain is more severe or will cause more death. And also, the current evidence shows that the current vaccination is still effective against this strain to prevent severe illness and death. So I will take this opportunity to urge people who have not yet completed their vaccination to receive them as soon as possible.
When we are talking about the increasing number of patients with malaria and the capacity of treating them in the hospital authority, we are talking about two issues. One is the space, another is the drug. For the space, since they will be placed in the isolation room because actually they are under quarantine. They came from the foreign country and need to be quarantined for 7 days in Hong Kong, so they will be put in the isolation facilities. When the demand of isolation facility, for example, Tier 1 airborne isolation ward is need, we will open the Tier 2 isolation ward. So the patients who has been stabilized in the Tier 1 ward can be transferred to the Tier 2 ward so that the capacity of Tier 1 ward will be increased to accommodate the increasing number of patients, no matter a COVID patient or a malaria patient. For the drug, we have purchased enough drug from the other countries as well as from our mainland China, so that we can have enough drug and capacity to deal with the increasing number of malaria patients in Hong Kong.
下一題右手邊前排近中間位男士。
The gentleman in the middle. AM 730. First of all, the HA talk about 94 male case. It was said that the family member did not report the positive case. Would you appeal to that case to make a report, or would you have special arrangements for them? Because a few days have lapsed. How many such cases are there? Would you take special action to follow up on these non-reported cases? What's the infection risk of someone taking public transport? Is it safe enough just to wear a mask for arrivals? Is it highly necessary to take point-to-point transportation? For the 58 malaria patients, are they staying in first-tier facilities? You mentioned about the quarantine period. Does it mean that after 7 days, they may be moved to second-tier facilities or leave the isolation facilities? I don't have any information about non-reported cases. If it's just oversight, and if they write to us, call us to tell us the reason. Say, for example, if they were unable to access the internet, then we would, depending on the situation, classify them as a confirmed case. There's always been a transmission chain in the community. A high-risk scenario is when one doesn't wear a mask. Patients will have to be isolated. In general, they will be put in an isolation ward, and that is mainly for COVID, because we don't know whether that case has been infected. If we leave them in a general ward, and if it turns out to be a positive case, there is a risk of transmission. Of course, when the quarantine period lapses, the case could go to wards that are properly protected, mainly prevention from mosquitoes. We have enhanced our mosquito control. So as to the nature of the ward, it depends on what kind of isolation we want to achieve, whether it's bodily fluid, air, or prevention or protection from mosquitoes. We'll make proper arrangements. Last question. The gentleman at the front. I'm from Mingpao. First, BA4 or 5. We can see from data of past few days, the BA4 or 5, the ratio has increased by a few folds. Does it mean that in another 3 or 4 weeks, it will account for half of the cases in Hong Kong? If that is the case, what is the impact of this epidemic situation in Hong Kong? Are there more reinfection cases? Has the percentage increased? Have these cases been vaccinated? Do you reckon that the number will increase? Of the death cases, how many of these cases are reinfection cases? In terms of procurement of medication, has the HA completed the procurement exercise, or they're still in the process of buying medication? We see that BA4 or 5 are on the increase, and as to the rate of increase, it's difficult to tell. We don't rule out the possibility that in the future, judging from the information from the mainland and from WHO, it may become a dominant strain in Hong Kong. In relation to reinfection, every day we see some cases of reinfection, but the percentage is lower than 1%. Yes, lower than 1%. So far, we have not seen whether there are more BA4 or BA5 cases, because most of the cases are BA2.2. We don't have the number of death cases from reinfection. For some death cases, we have tested residual viral load in the patient, so it's suspected to be a re-positive case. For most of these cases, when they're admitted, it's mostly not because of COVID, but from a fall or from heart diseases. We'll conduct PCR tests on the second and the third day. That's how we identify these cases. We will monitor the viral load before we assess whether it is a new case or it is a case of repositive. In terms of medication procurement, from all over the world, including the mainland, we procure medication for different diseases, and they will serve as our inventory or our stock. As you can see, the number of malaria cases has been increasing, and compared to previous years when we had maybe 10 cases or less, we have more. And the condition of patients upon admission is more serious. So we have, on an emergency basis, procure medication from different places. We have successfully procured intravenous medication as well as oral medication. We have sufficient supply for use. We will prescribe suitable medication to the individual cases. We will seek advice from experts as to how much more medication we need to procure. That's the end of the press conference. Thank you.